Hello, everybody, and welcome to Functional Medicine with me, Dr. Howard Robbins. Uh, our show is dedicated to offering you safe and effective ways of treating many, many serious health issues. Some of them are life-taking, and some of them are diseases and conditions that will make you won't take your life, but will make you wish you were dead. Today, we're going to talk about psoriasis. You've heard the expression, the heartbreak of psoriasis. It's a very upsetting condition. I don't really call it a disease, though it could be called a disease because it's often considered a chronic autoimmune disease. When psoriasis is a chronic autoimmune disease, we have an answer for it. When it's caused simply by stress, I hate my mother, I hate my father, I hate my car, I hate my truck, I hate my dog, I hate my life, I hate my wife. Can't fix it. You've got to deal with the stress in a different way. Your body is trying to get rid of the stress this way. I once had a patient many years ago, head to toe psoriasis, did everything for it, nothing worked. Didn't keep, barely could keep it in control. Horrible. And of course, the patchy skin and everything, besides being itchy and whatnot, is also can be very embarrassing. You're shedding skin cells all the time in your clothes, and it can be a very upsetting and embarrassing socially and emotionally, psychologically, and even spiritually kind of a problem. So I take it very seriously. When you had this one patient, as I was saying, head to toe. He went to Israel and went to the Dead Sea. Now, this took place in the late 1970s. I'm in medical practice 52 years now, as of the date of this show. And so he went there. He came back completely clean. He said, "Oh, it must have been the sun and the laying in the salt water of the Dead Sea." I said, "No." He was a very wealthy man. He was the CEO of a big company. And he was under a humongous amount of stress. He just couldn't deal with it in a way that let his body not have to cause this reaction. And I said to him, "How many phone calls did you take while you were there?" Remember, this was in a day and age where there were no cell phones. And his answer was none. And I said, "That's why you're fine." 2 weeks after returning home, he was covered head to toe again, proving the stress-related condition there. Stress can bring on other conditions similar to it, like neurodermatitis. Well, when it's caused by medical problems, we can eliminate it, probably permanently, completely, once and for all. Um, when it's caused by stress, we can improve it. So this show is going to help everybody, whether whichever causes that you really have. Now, when it's an autoimmune disease, and you'll see psoriasis has scaly patches on the skin, the scalp, the elbows, the knees, that's when it just works on the joints, but it can be all over the skin, okay, with these plaques. And there's different types of psoriasis. You can have plaque psoriasis, where you have these raised, scaly little patches. You can have inverse psoriasis, which affects the skin folds, and this causes smooth red kinds of lesions to appear. You can have erythrodermic psoriasis. This is a very rare and severe form where you get this widespread redness and scaling. That's like the head to toe type. You can have a horrible form of it called guttate psoriasis. This can be sometimes triggered by infections like a strep throat, and you get small drop-like spots. And then, of course, another rare form called pustular psoriasis. This is where you get white pustules surrounded by inflamed skin. Now, it can also affect the nails on the hands and the feet and cause very thickening, ugly, horrible nails. It's sometimes mistaken for fungal nails, but it's not. Okay. And what's happening, the skin cells, they are accelerating very rapidly in their growth. And the immune system is apparently attacking healthy skin cells. At least that's what's believed. And there are many different triggers, from skin injuries, infections, medications, alcohol. Okay. I mean, you want to avoid toxins and ingesting toxins. So let's get into the treatment of this. You want to avoid ingesting toxins. So, first of all, you got to be well hydrated. This is very important. The average person walks around in a dehydrated state. You need to be drinking 3 to 4 liters, 3 to 4 quarts of healthy liquid every day. Now, water is fine, but you can also, but it has to be purified water. This is important. Distilled or purified water. If you're worried about distilled water removing minerals from your body, which some people consider as an issue, then to every gallon of distilled water, add a teaspoon of sea salt, because it contains all these trace minerals. To each quart, you can add a quarter of a teaspoon. To each liter, a quarter of a teaspoon of sea salt. You won't taste it, but it's putting the mineral salts back in. Reverse osmosis water, hydrogen water, ozonated water, all these are wonderful ways to drink and put healthy liquid into your body. Now, to really attack this, you have to attack it from the point of view that you need to cleanse and detoxify your body. Now, I'm going to get into the real therapies, but these are very important things to help people who are suffering from this. First of all, the liver and the kidneys are the main detoxifying organs in the body. And many people walk around and need to improve their liver function and their kidney function. Now, there's certain herbs that you can use that will improve liver function, for example. I have notes here, so when you see me looking down, it's because I don't remember all these things purposely. You know, a lot of doctors would like to act like they know everything, and the one thing is, I used to. Today, I use my notes and everything to back up so I don't leave anything important out, because I've had a few of my friends say, "Why aren't you looking directly at the screen all the time?" And I just don't want to leave anything out. I mean, you can be doing various herbs. Now, how much to take? Everybody is different and of a different size. So you want to take usually recommended doses by the companies that make it. And if you're having a problem, you can add on 1 or 2 more capsules. Ideally, you have somebody that can do muscle strength testing, what we call applied kinesiology testing, muscle strength testing, to show how many to take, when to take it, whether you should take it or not. That's something we do, we've been doing for, well, many, many years now. But agrimony and barberry and dandelion root and echinacea, milk thistle, sassafras, red clover, sarsaparilla are all wonderful herbs to help boost the liver function. For the kidney, you have bucha and corn silk and clevis and goldenrod and parsley and celery seed. These are all wonderful herbs to boost kidney function. People also go on liver cleanse, and you can look those things up. I'm not going to go into the details now, but you can do a liver cleanse, which is also a wonderful way to boost your liver function and clean it out, particularly if it's been overloaded with stuff. Remember, you want to avoid drinking caffeinated beverages, coffee, juices, liquids that have refined sugar in them. Green juices, very valuable for this. Green juices. You can throw in some of those herbs that we said into a green juice. Oh, let's see. I would add garlic, ginger, okay, into the green juice to help with a cleanse. You want to use always organic vegetables for it. Only organic vegetables. You could add carrot into it. Carrot is very important because there's vitamins that you can take. So now you want to do at least 16 ounces of a green juice every day without to certainly help with this problem. Even twice a day is good. Don't make it and then let it lay around all day. That's not any good at all. It loses its value. It loses its value. You could be drinking green tea and, very importantly, red tea. You may not know of red tea. Green tea and red tea both contain phytonutrients and enzymes and immune-boosting chemicals that are very valuable, particularly with skin conditions. In terms of supplements to take, you should be taking about 50 milligrams of a chelated zinc. I usually recommend zinc piconolate. I don't know if that's the number one anymore, but zinc piconolate seems to work very well. Chromium, again, that has to be tested. That's a trace mineral, and you want to test that to make sure you're not overdoing chromium. Vitamin A. 10,000 IUs a day at least. You could do 20,000. Remember, you may not be absorbing it all. Vitamin E, 200 to 800 IUs a day of the mixed tocopherols. Tocopherol is vitamin E, and mixed tocopherols is the best way to go. B6, another pyridoxine is another important one, along with lecithin. Vitamin C. You need to be taking vitamin C 1, 2, 3,000 milligrams every 2 hours. Yes, you heard right. That's 5 or 6 doses a day, every 2 hours with vitamin C. Remember, you're going to utilize it. And the liposomal vitamin C, if you buy a high quality one, when things are too cheap and everybody else is selling it for more money, I start to wonder, how can somebody why is everybody else higher in price than this guy or this company is lower in price? Ridiculously lower. It makes me wonder about the quality and if you're really getting what you're paying for. So I like to say only go with high quality supplements from high quality companies, and there's many good ones out there. Remember, anything that's good for hair is good for skin. All right, so keep that in mind. Now, so vitamin C, 5 or 6 doses a day, 1 to 3,000, 4,000 milligrams. You take it to stomach tolerance. That means you don't get an upset or queasy feeling when you drink it. Make sure you drink everything with lots and lots of water. So you want to take it to your stomach's tolerance. If you take it too much, you'll have diarrhea, and obviously we're intolerant of it. Liposomal C is a good way to go. The buffered powdered vitamin Cs, if you can't swallow capsules, are another good way to go. I don't recommend particular brands for reasons. Now, you can contact a company by the name of Promolife. Promolife.com. Call them. Tell them that you heard about it here on the Dr. Robbins Show. And what you can do is you can get an ozone sauna, okay, that they sell. They sell a couple of versions, and you can sit in an ozone sauna. This is going to attack the problem on your skin wherever it is. The only thing that sticks out is your head, which makes it kind of difficult to fix it when it's in your scalp and around your face and ears. But you can also get organic ozonated glycerin. Organic ozonated glycerin, and you can rub that into these patches 2 to 3 times a day. It'll stop the itching to a great degree, if not completely. It also acts as a humectant, so it absorbs moisture into the skin. And so we're putting moisture into the skin from the inside out, drinking the water, and from the outside in with ozonated glycerin. And again, if you contact Promolife, they make the best ozonated glycerin that you can get. They also have a special a device, Easy O3, where you can make ozonated water in just 3 or 4 minutes. And you could be drinking that every day, several times a day. So contact Promolife at promolife.com. Get their phone number and call them. And if you tell them you heard about it here on Dr. Robin's show, they may give you a percentage off or something like that. Now, last but not least, and I mean not least, the skin is an organ and it connects to your gut. Everybody that writes about this will talk about the importance of getting a healthy gut again and rebalancing the gut. And that's where Doctor's Biome comes in, our special probiotic beverage. Go to doctorsbiome.com, doctorsbiome.com. And you can purchase Doctor's Biome. It's a 2-ounce shot, 100% organic juice with prebiotic in it. So these 15 patented strains are created to survive the stomach over 90% and then stick to the wall of the gut. And you're going to say, well, why can't I take my regular vitamin C? Well, capsule powders and tablet versions of vitamin C are completely destroyed in the stomach, if not, and that's if they do come out of suspended animation when they were freeze-dried, which destroys a lot of it to begin with. So while you think you're getting a benefit from it, there's a lot of research that shows minimal benefit from that, whereas maximal benefit from Doctor's Biome. And last but not least, very much not least, is ozone therapy. Almost any form of ozone therapy will help boost the immune system, so I'm not against any of the methods that you might have locally available. The direct IV method has proven itself to be extremely effective against the autoimmune diseases, particularly psoriasis. And that's something that we do in our Manhattan office. You can listen to our show called Intravenous Ozone Therapy, Everything You Need to Know. It goes over all the different methods and why we prefer the ones that we prefer and use, the more powerful ones that are able to eliminate problems, not just improve them. I'm in favor of any of the methods, but if you're not getting great results, you need to be using these more powerful ways to try to really eliminate it. And again, it needs to be done several times a week because it's just medicine. But I've been able to eliminate psoriasis completely in people because of the major benefits against autoimmune disease with intravenous ozone therapy. If you have any questions about this, you can email me at ozonedoctor, OZONEDOCTOR, at yahoo.com. You can also call my office in Manhattan at 212-581-0101. That's 212-581-0101. And tell them you need to speak with me about your medical problem. They don't have to say what it is. So those are the ways to reach me. I certainly would be happy to speak with you and give you a little bit more support. Please tell everybody about our podcasts and please sign in as a subscriber and with a like if you feel this show did you any good. You'll probably find that a lot of our shows are very beneficial, and you'll be able to send your friends to many of the different shows that we've done and we're going to continue doing. Everybody stay healthy, stay well, and thank you for watching and listening to us. Bye now.